So today we are going to discuss about the sacroiliac joint, kinetics and kinematics. So the pelvic ring, if you discuss about the pelvic ring is made up of two ilium, and it has and one sacrum, right? So it makes a three joint. Clear? One is two sacroiliac joints, right and left sacroiliac joint, and pubic symphysis. It makes a pelvic ring. So when you talk about the motions or movement of the sacroiliac joint, there is no such definite muscle which controls the movement of the sacroiliac joint. The movement in the sacroiliac joint is described as a nutation and counter nutation. So what is nutation? Nutation means the sacrum, if the sacrum is moving forward, that is the base. What is the base of the sacrum? This is the base of the sacrum, right? The topmost part of the sacrum is the base of the sacrum. When the base of the sacrum is moving forward, or it is moving forward and downward with respect to the ilium on either side, so it is called as a nutation, right? Again I'll repeat, when the sacrum, the top of the base of the sacrum, when it is moving forward with respect to the ilium on either side, it is called nutation. Or if the and vice versa, that is, if the sacrum is moving backward, that base of the sacrum, if it is moving backward with respect to the ilium, then it is called counter nutation. So this nutation and counter nutation, it can occur in different way. That is, if sacrum is moving on ilium, that is, if both the iliums are fixed, clear, and the sacrum is moving, it is called, that is forward tilting of the sacrum, it is called a nutation. This movement is described as movement of sacrum on ilium. So there is another possibilities are there. What is another possibility? Or in other words, if sacrum is moving backward and iliums are stable, then it is called counter nutation. This is one type of movement. So what is other type of movement? That is, sacrum is fixed and the ilium is moving anterior and posterior, right? That is, sacrum is not moving. Ilium, both the ilium, if it is moving forward, if the sacrum is fixed, then it is called counter nutation, because here what happens, the ilium is moving with respect to sacrum, clear? Previously sacrum was moving and now ilium was moving. So this is called iliac on sacral movement and sacrum on iliac movement, clear? And so nutation and counter nutation can occur in other way also. That is, both the sacrum and ilium can move simultaneously. Clear? Sacrum is moving forward. Previously we discussed sacrum is moving forward with fixed ilium. And secondly we discussed ilium is moving backward with the fixed sacrum. So another third movement is both the sacrum and ilium, they can move in the opposite direction simultaneously. So nutation and counter nutation occurs in three parts, right? So next we will talk about the functional consideration of the sacroiliac joint. So here, so what is the main function of sacroiliac joint? The main function of there are two main functions, major functions are there. One is it helps to relieve the stress within the pelvic ring. Again I'll repeat, it helps to release or relieve the stress in the pelvic ring. And second is it helps in transfer the load of the axial skeleton to the lower extremity. First is stress relief, and second is it helps in transferring the weight from the axial skeleton to the lower extremity. So first we will discuss about how the stress is relieved in the pelvic ring. As we already discussed, pelvic ring, it makes two ilium and one sacrum, posteriorly two joints, sacroiliac joints, and anteriorly pubic symphysis. So it makes a pelvic ring. So what happens? Yes, there is a very slight movement occurs in the sacroiliac joint. Clear? Even in pubic symphysis and both the sacroiliac joint in adult. So 4 degrees of movement, 1 to 4 degrees of movement occurs in the sacroiliac joint, and translation also occurs between the joints, that is about up to 3 to 4 millimeters again. So it's very minor movement, range of motion is very small, and there is no specific muscle which controls the sacroiliac joint movement. The core muscles and the other muscles surrounding the pelvis is responsible for this slight movement of the sacroiliac joint. So, for example, and so this slight movement, slight degree of movement is important to relieve the stress within the pelvic ring. For example, so when it is required, this is required when the person is walking or when the person is running, and in women during delivery process, during labor time, what happens? This slight movement is required and it is important. So it relieves the stress within the pelvic ring. For example, if a person is walking during normal walking phase, what happens? The lower extremity it moves reciprocally, flexion and extension. So one extremity is in flex position and other extremity in extend position. When a person is walking, clear, the forwarding extremity heel strikes, clear, and the backward extremity, the toe is in touch with the floor during normal walking phase. So in this position, what happens? The muscles and the ligaments around the sacroiliac joints are tensed and they create the movement. Which movement? Nutation and counter nutation movement occurs when a person is walking due to flexion reciprocal position of the extremities. So what happens? Right extremity is in flex position and left extremity is in extended position. So when right extremity is in flexed position, what happens? The pelvic, it movement, the innominate, right and left and innominate, it moves in opposite direction, right? So what will happen if the muscle is stress, if this muscle tension, it creates the nutation and counter nutation. Suppose if the joint is fixed, that is if the pelvic ring it does not allow the movement, so what will happen? There will be a undue stress in the pelvic ring, right? So to prevent this undue stress in the pelvic ring during normal walking, slight movement of the sacroiliac joint is necessary. Why? Because to prevent the undue stress within the sacroiliac joint, right, or undue stress within the pelvic ring. Suppose if pelvic ring is fixed, so if there is no movement occurs in the ilium, sacroiliac joint, what will happen? There may be a damage to the joint. Clear? So this is the first reason why the slight movement is required in the sacroiliac joint. And second is during the labor process. During the labor, what happens? Which movement occurs in the during labor? Nutation movement occurs. So what is nutation? Nutation is, see, this is supine position, right? And this is the sacrum. The sacrum, nutation occurs. What is nutation? Nutation means the superior surface or the base of the sacrum, it is moving forward, right? So when the base of the sacrum it is moving forward, then what will happen? This opening, that's pelvic floor, it opens, right? When the base is, suppose if this is the sacrum, when the base of the sacrum is moving up, then what will happen? The inferior portion of the sacrum will go down and it opens the pelvic floor, clear? So which helps in the labor process. So this is if the nutation is not occurring, it will be difficult during the labor process. So that is the importance of the stress relieving factor or stress relieving part of the sacroiliac joint. And second functional consideration is stability and load transfer between the axial skeleton and the lower extremity. So if you see the orientation of the sacroiliac joint, so the sacroiliac joint orientation is almost vertical. That is, it is sacral joint is like this, ilium joint is like this, and ilium and sacrum joint is like this. So the orientation of the sacroiliac joint is almost vertical. Clear? See, if you can zoom it. So here, if you see it is almost vertical. Sacroiliac joint plane is vertical. Suppose When the weight is transmitted from the axial skeleton to lower extremity, there is a possibility of slipping of the ilium from sacrum, right? So suppose if weight is transferred, what will happen? There is a possibility of slipping of the sacroiliac joint in the vertical direction. So this should not happen. So for this, the nutation of the sacrum is considered as a stable position for the sacroiliac joint. That is, suppose if the sacrum is that is nutation and counter nutation. Clear? What is nutation? Nutation is base of the sacrum is moving forward. When the base of the sacrum is moving forward, then what happens? It is locked basically. The sacroiliac joint is locked, and in that position, if the sacroiliac joint is locked, then what will happen? The joint becomes stable, and it helps to transfer the weight from the axial skeleton to the lower extremity. So nutation position or the locked position, or it is otherwise called the close pack position. Close pack position of the sacroiliac joint is nutation. So this nutation is achieved by certain muscles. Already we discussed there is no direct muscle which controls the nutation movement, nutation and counter nutation. The muscles, so stabilization is required during weight transfer, and this stabilization is achieved by the nutation of the what? Sacrum. Clear? So this nutation is done by which muscles? So there are muscles which surrounding the pelvis, for example. So erector spinae is attached here in the posterior surface of the sacrum, it runs up, right? And rectus abdominis muscle is attached to the pubis. Clear? So this muscle is acting in this direction. So imagine a rope is tied in the pelvis here. When this is pulled up, what will happen? The pelvis will rotate backward. Backward rotation of the pelvis occur when this muscle is contracting in this direction. And when the erector spinae muscle is contracting in this direction, what will happen? Sacrum will rotate forward, right? So sacrum is rotating forward and ilium is rotating backward. So which is the nutation of the sacroiliac joint? So this movement helps to lock the sacroiliac joint, and it helps to transmit the forces between the axial skeleton and the lower extremity.